Good afternoon, everyone. My name is Dr. Tager, and I'm a chiropractor in South Burlington, Vermont. And the reason why we're here today is because we're talking about peripheral neuropathy. Now, what exactly is peripheral neuropathy? Well, peripheral neuropathy refers to conditions that result when the nerves that connect from the brain to the spinal cord and then the rest of the body are damaged or diseased. The peripheral nerves make up an intricate system, an intricate network that connects the brain and the spinal cord to the muscles, the skin, and your internal organs. Now, what we see here is this is an example of the peripheral nerves, and they come out of the spinal cord and they're arranged along lines called dermatomes. Now, typically damage to a nerve is going to affect one or more of these dermatomes. What we have to remember is when the nerves actually come out from the spine, they will come out in between these things here called vertebrae, which are the bones in the back. And these bones, these nerves are actually going to go everywhere in your body. They're going to go to your heart, your stomach, your lungs, your eyes. Whatever you have that functions has to have a nerve going to it, or it's not going to work. So damage to these nerves is going to interrupt communication between the brain and other parts of the body. It can also impair muscle movement. It can prevent normal sensation from happening in the arms and the legs. And of course, it can also cause pain. Now, there's different types of peripheral neuropathy. There are several kinds that stem from a variety of different causes. The most common cause is carpal tunnel syndrome. So we see that a lot. Carpal tunnel syndrome, what we see is in the actual, above the wrist here in the two rows of bones in the hand, there's actually a tunnel in the middle here called the carpal tunnel, and that's where the median nerve runs through. So if that's damaged in any way, you're going to end up having problems through that carpal tunnel. Now, as a group, peripheral neuropathies are very common, especially among people over the age of 55. Now, we have what's called mononeuropathies. So mononeuropathy is damage to a single peripheral nerve, hence the name mono. This usually results from a physical nerve injury or a trauma is the most common cause. You can have prolonged pressure on a nerve caused by extended periods of being sedentary, such as sitting in a wheelchair or lying in a bed, or continuous motor movements can also trigger a mononeuropathy. If the discs in the back that we just talked about right here, if the discs here that are in between these bones are damaged, then they can actually press on the nerve. The disc itself can press on the nerve, and this can cause a kind of neuropathy. So with carpal tunnel syndrome, as I mentioned, it's the most common form of a mononeuropathy. People whose work requires repeated motions with the wrist extended are at a greater risk. So somebody that's using a keyboard a lot at their office, they're going to be at a greater risk. The damage to the nerve can result in numbness. You can end up having tingling, and usually those sensations end up in the first three fingers on the thumb side of the hand. So your thumb, your first finger, and your middle finger. In time, carpal tunnel syndrome can weaken the muscles of the hand, and you may actually start feeling a tingling or burning sensation or pain as well and throughout the hand and the wrist. It doesn't just have to be in the carpal tunnel. Now, autonomic neuropathy. Neuropathy can affect the nerves that control the muscle movement and those that detect sensation, such as cold or pain. In some cases, it can even affect your internal organs, because like we talked about, when those nerves come out from the spinal cord, they're going everywhere in your body. They're going to your muscles, they're going to all of your internal organs. So even things like your heart, your blood vessels, your bladder, or your sexual organs or intestines are going to be affected by the peripheral nerves if they are damaged. Now, polyneuropathies. Well, a polyneuropathy, they account for the greatest number of peripheral neuropathy cases. This occurs when many peripheral nerves throughout the body malfunction at the same time. Now, this can have a wide variety of causes, including exposure to certain toxins, poor nutrition, which is a huge factor, or complication from diseases such as cancer or kidney failure. Now, one of the most common forms of chronic polyneuropathy is what's called diabetic neuropathy. Now, this is a result of poorly controlled blood sugar levels. Some of the symptoms include tingling, numbness, or a loss of sensation in both the hands or the arms and the legs or the feet. Now, people with chronic polyneuropathy often lose their ability to sense temperature because those nerves are being damaged, and that's not just the motor part of the nerve, it's the sensation part, so the part where you actually feel temperature, and pain as well. So what can end up happening is they can actually burn themselves and develop sores as a result of injury for prolonged periods. Now, if the nerves serving the organs are involved, then they could end up having problems like diarrhea or constipation, as well as a loss of bowel or bladder control. Now, you might also have sexual dysfunction and abnormal blood pressure because those internal organs are being affected by those peripheral nerves. What causes peripheral neuropathy? How does this occur? Well, you have acquired neuropathies, which are caused by environmental factors such as toxins, trauma, illness, or infection. Some of the known causes of acquired neuropathy include diabetes, alcoholism, poor nutrition, herniated discs, certain cancers, certain medications are going to cause this, and we're going to get into that a little bit later on. Kidney or thyroid disease, Lyme's disease, shingles, and AIDS as well. Now, neuropathy is an outcome. It's an effect. It's not a cause. The question that you may ask yourself is, what conditions attracted my neuropathy? It is essentially